my name is Roger Barnett, and I'm the chairman and CEO of Shaklee Corporation. And today is another session in our Doctor is In series. And we have the incredible opportunity and privilege from listening to one of the leading health advocates in the world, Dr. Michelle Williams, who is the dean of the Harvard Chan School of Public Health. She is an epidemiologist by training, which is so needed at this time, and was on the faculty before becoming the dean. She's an extraordinary leader at an extraordinary time. And one little known fact perhaps about her is that she has personally authored or co-authored over 450 publications and peer-reviewed scientific publications, which just is an extraordinary amount. I know her well. I can't imagine where she finds the time to do all this. But Dean Williams, thank you so much for joining us today.
Thank you. Thanks so much, Roger. It's a pleasure.
I just think it's such a opportunity for people to listen to you. The Harvard Chan School of Public Health is one of the leading public health institutions in the world. We are in a period of unprecedented health crisis in the last 100 years. What's it like to be an epidemiologist and the dean of one of the leading schools of public health at this time?
Well, Roger, that's a big question. And I would say my answer to that question changes by the moment, because as we make it through the 6-7 months of this pandemic, all emotions have been brought forward. Emotions of panic, emotions of frustration, emotions of gratitude, and determination. And I'll start with the panic. The panic comes from the fact that as a public health specialist, and one who has been a part of the chorus arguing that it was not going to be if, but when we would face a challenge of this magnitude. The frustration comes from our not being listened to, not being heard. Frustration also comes from the fact that we as a society, as a nation, as a globe, missed all of the opportunities to bring this crisis under control, largely because of a lack of a coordinated leadership response, lack of preparedness, despite our having the scientific wherewithal and the will to control this. Inspiration comes from the resourcefulness that you see in different pockets of the world as a response has come about. Inspiration from what we saw in Hong Kong, Thailand, where disciplined commitment to changing personal behavior to diminish the spread of the virus has resulted in the desired outcome of breaking the curve, breaking the transmission. Inspiration also comes from the heroicism that we see from our frontline health workers. But I would say hope comes from the fact that our school just opened 2 weeks ago, and we have almost as many students coming into the School of Public Health remotely, but engaging in their studies during a time of pandemic, because they're running towards bringing solutions to the world, not away from the challenge. And so as a dean of the Harvard Chan School of Public Health, I'm inspired more than I am frustrated, determined more than I am pessimistic that we'll work our way through this, because we are a evidence-based, science-driven, committed to addressing humanitarian crises. And this is a humanitarian crisis of epic proportions, and that we have the will and the capacity to break through apathy, indifference, and I would say spotty leadership to get this challenge crisis under control.
Well, thank you for the work that you and your colleagues and students are doing. Dean Williams, where do you think, how do you think COVID will end? What do we need to do as a community, as a nation, and as a global community to put an end to this pandemic?
Yeah, Roger, that's a great question. And, we have not had many successes in eradicating or ending infectious disease threats. We've eradicated smallpox. We may be on the verge of eradicating polio, if not just there. And so one of the things we might want to do is parse that question into two. First is, how and when might we control this so that we can get back to our lives? And what I would say is we have the means to control the spread of COVID by our personal behaviors, distancing, wearing masks, hand washing. And we know that those interventions are effective in breaking the transmission. If we can continue to do that while the scientists can bring about vaccines, effective, safe vaccines and treatments, then we can start to see how, even if we can't completely end the transmission of this virus, we can at least reopen and bring back some sense of normalcy to our work life, our life engaged in the economy and in education and so on. I think we will get there, but it will take time to get through the vaccine testing and safety and implementation delivery challenges that we are inevitably going to face. But we can, even before we eradicate or end this, get to a place where we can reopen society and move about safety.
I think that's one of the things that is on everybody's mind is exactly when, because there's the health impact and the economic impact, but there's also the mental wellness impact, the lack of connection and community. And then there's different perspectives amongst, let's say, our citizenry in different parts of the world about how seriously they're taking their personal behavior changes to this. So I know there's no scientific answer, but if people are following the protocols that you suggested, do you have a sense of when you think a greater sense of normalcy will return?
Yeah. Okay. So let's try. Let's say if we could have a vaccine that is adopted by 60 to 70% of the population, because that's the latest estimate of herd immunity, is about 60 or 70%. If we could have a vaccine that's adopted by 60 to 70% of the community by the end of 2021, we might be able to really get back to our close to our full engagement in society. We can probably do that before the vaccine if we did practice the social distancing, the mask wearing, the hygiene practices, and we reorganized how we engage in our environment, our air filtration processes, for example. We could probably get back. We'd have to have testing to identify where there are small pockets of outbreak that would happen before. But I would say if we did all of the behavioral public health intervention, non-pharmacological interventions now, we could pretty much get back to some place that resembles normal. And I say that because we've seen glimpses of this in parts of Europe, in Germany, and in France before behaviors again overtook the bringing down the transmission. It will require testing though, and it will require that personal commitment to the social contract of delaying, deferring some things like, gathering in large groups.
Right. Have you done work, Dean Williams, about, it's an interesting dynamic that when states or communities or local provincial areas start to open up because the transmission rates go down, sometimes the citizens in that area view it as an opportunity for them to also open up and not be constrained in their behaviors. And are there any learnings from other public health crises or other issues of how that we can encourage people to stay vigilant while things are open up rather than the opposite?
Yeah, that's a great question. I think there are lessons that we could learn from the influenza, of 1918, where there were cities that practiced social distancing and managed to keep transmission low and managed not to bring their entire economies to a stall and managed to keep death and morbidity low. And there are other cities that chose to go ahead and have parades and ended up in the end paying the consequence of human life lost and economics being hammered. Right now in the US, there are models of, there are states, New York, Massachusetts, where under very thoughtful, careful leadership, governors have managed to open up on a phased way using evidence from the positivity rates of regular testing, the 7-day moving average of proportion of tests that are positive. Using that indicator as a way to open fast or slow down reopening that has allowed, Massachusetts, for example, to now get to phase 4 of their opening. So there are examples even today where if one follows the evidence, one models the behavior of good, clear communication and leadership, and uses that to persuade the population to adhere, to the messages of the public health behavioral interventions, we have seen that we are, able to get advanced back towards what will be a new normal until we have that vaccine and treatment.
Let me continue on the thread of the public health communication and messaging. And one of the hallmarks, many hallmarks of what you have done since becoming dean is you have greatly expanded the communication into the public domain. And I think one of the things that our Shaklee family members, and this is one of the reasons why we exist as a company, is to help provide information about how to live a healthier and better life to people through peer-to-peer transmission. So right now you'll have, on the first airing of this, you're going to have tens of thousands of Shaklee family members from around the world tuning in and watching you. What message of public health do you think is most important for them to share?
Yeah. This is a great audience because I know that the Shaklee members are invested in the importance of self-care and wellness. And I would say that, good public health really begins with appreciating and understanding the investment it takes to support the health and wellness of yourself and your family. And I will say that this message was best appreciated among public health professionals, including myself, when we saw that the challenge, the physical stress and the mental strain of responding to this epidemic that turned into a pandemic was going to compromise, attenuate the resiliency of our frontline health workers. And frontline health workers are trained to think about the health and wellness of others before they think about the health and wellness of themselves.
Right.
And so I think modeling the behavior of self-care and wellness, especially in a time of crisis, is a message that your members can bring forth. And in public health, we think of the individual, but we also work on a scale of populations at a time. So what I would say is take that well-earned, well-known investment, that value of self-care, and try to be the force multiplier. Bring it forward, make it real, bring it to the places where other people who are not there yet, bring it down to their level where they can see and internalize and appreciate the value of self-care, self-wellness. That will then multiply into family-based, community-based, population-based, public health investment in protecting, preserving, and promoting health. And the reason I love public health so much is because it is that place where science and evidence intersects with humanitarian drives and urges. And so I'd say all of us can be public health professionals by modeling investment and an understanding of what prevention, wellness, self-care brings forward to a population scale.
That's so inspirational, because the reason why I love Shaklee so much is exactly for that same reason, because our wonderful members of our Shaklee family do that. And I tried to explain, but you did it far more eloquently than I did, how just by modeling and sharing information and access to products that help make the healthy lifestyle easy and accessible for people, and then providing community and support for that, they can be a multiplying effect. And even though it starts with one person at a time, if there's enough people doing it, we can start impacting population health dynamics at the same time. And thank you. I know that will inspire people, that message for everybody to be agents of change in a positive way. So I appreciate your articulating it in that format.
Sure.
I want to shift to another subject of conversation, because, by the way, with the frontline healthcare workers, I also want to say that our Shaklee family, we have a nonprofit called Shaklee Cares, and we gave things, energy products and foods and sanitizers and all these things to the healthcare workers. And the notes of gratitude that they gave, they're so remarkable. They're just giving so much of themselves to frontline health workers that, and we're just trying to say thank you, but their thank you is even more than our thank you. They're just remarkable heroes and heroines around the world.
No, that's great. Can I just say, this pandemic made me have conversations with a lot of friends in the public sector and the private sector. And you know Larry Summers. I was having a conversation with Larry Summers, and I said to him, academic public health can't sit on the sidelines here. I'm really worried about our frontline health workers, and I want to do something. And he said, the traditional first responders, firemen and policemen, they have a saying, who watches the watcher? And he said, Michelle, what you're asking is who cares for the caregivers?
Right.
And I have to thank our friend, Larry Summers, for making that so clear, that we do have to ask that question, who cares for our caregivers, especially during this time of crisis? And I stood up and said it should be public health. But it really is all of us, because our caregivers are our front lines for public health during times of peace, when we're not in a pandemic, but also during a pandemic when they really are, at the tip of the spear. They are at the front point of the risk. And so caring for them, really important. And I'm glad that you and the Shaklee family have, joined in the efforts in protecting our front line, because they're protecting our public health.
They are. And for those of you listening, Larry Summers was the former Secretary of Treasury of the United States and the former president of Harvard University. and sort of remarkable thinker. So that's a great question that he asked. Okay, let me switch topics because the world has been active. We've been confronting different crises. We have the health crisis, and there's also conversations, particularly in the United States, that are going on about race and inequality. And in a way, so much is connected because without health, if there's income inequality, you're going to have health inequality, and then you can have racial inequality, and they're all connected. And tell us, I know that you have passion about this. You've written a lot about the impact of race and health, even identifying that there is racism in our healthcare system, and it's systemic and the results of it, and that to be an equitable and just society, we have to address the underlying causes. Can you share some of your thoughts about that? We'd love to hear your perspective.
Sure. Thank you, Roger. This has been really a tough period because we have experienced in a very short period of time the trauma of the pandemic, a biological convulsion. And then we all observed the murder of George Floyd, which created a societal convulsion. And then, of course, overlaid is the economic convulsion that we're experiencing as a result. And I would say that prior to the pandemic, when we started the academic year in August, September of 2019, many of our universities and all of our schools of public health were commemorating the 1619 year, the first year of slavery, handful of slaves brought to the United States. And so we started the year as a school community at the Harvard Chan thinking and reflecting on the long legacy of the founding of our nation and on the exploitation of Black people in the history of our country. And that forced our school community and our university community to really think through the long legacy and lasting and persisting legacy of the structures of institutional and systemic racism has had on health disparities. And we had professors from the Faculty of Arts and Sciences like Evelyn Hammond, and journalists, Linda Villarosa, engage in meaningful transdisciplinary discussions that brought forward what many of us in academia understand, but brought it forward to a consumable level for others to hear about how social determinants, how access to housing, access to the capacity to have the resources for retaining land, for income generation, access to education, all of these historically impacting in some way mental and physical health of Black and brown people in this country. And it's not always obvious to everyone because not everyone has always been afforded the opportunity to understand the connection of historical institutions and practices and how that helps us understand why housing laws of the past put Black and brown people in communities that are more polluted. And that pollution leads to higher risks of respiratory diseases. And that higher risk of respiratory disease contributes to a downward spiral for economic opportunities. And so what we learned and what we appreciate, and COVID helped make this more clear, is that we have to reckon with the historical and present effects of systematic racism and appreciate how that drives the health disparities that we see. David Williams, for example, has done a tremendous job drawing very clear lines between how redlining of the past still contributes to the higher risk and higher burden of exposures to air pollution and lead, childhood lead levels, because of how Black and brown people were kind of forced economically into communities that never had rejuvenation, never had revitalization, and how that exposure to those environmental toxins contribute to decline in cognitive development, and how those declines in cognitive development lead to then a number of behavioral and physical health outcomes. These are complex stories. And what we have to do is allow for a larger segment of our population to understand the complexity, appreciate where the levers are to make change, and then allow for those changes to happen with good evidence being brought forward in changing policies and making interventions that have an impact in bringing about equity. Access to COVID testing, for example, Roger, was an afterthought for some Black and brown communities. And, it was startling to see that even in communities where workers did not have the luxury to work remotely, they had to be on the front lines. They were essential workers, but they were doing this at the expense of their health and their family's health, with very little attention to the inequitable distribution of testing options. And then those who had symptoms of COVID live in communities where the health centers are not of the highest quality. We saw this in reports from New York, where Black and brown communities with hospitals that were last in line for protective equipment did not have the staff sufficient to meet the capacity, were overrun more quickly than other hospitals and centers in other communities. So COVID laid bare the inequitable distribution to opportunities for quality health testing, but allowed us also to begin to socialize more widely the historical disparities that lead up to the disparities in health that we see. I hope, I'm optimistic that the conversations that we're all having now that engage people across all sectors, athletes, artists, scientists, CEOs, citizenry across the spectrum, asking questions, continuing to engage, and being inquisitive enough and curious enough and insistent enough to want to have real change gives me a sense of optimism that a greater understanding of the social determinants of health, which account for about 80% of our health and wellness, comes from these factors that are influenced as a function of where we live, work, learn, and play. Way outside of the healthcare system specifically, in communities, will drive resources upstream to address these health disparities. And if we do that, Roger, I think we'll all benefit. I think we'll have a more secure human resource and community of healthy people to engage in civic society. And I think we'll have a richer, more vibrant future, because we will have input, engagement, and full functions of all of the members of our community.
Thank you for sharing that. I want to reintroduce and repeat a phrase for our audience, which is going to be more commonplace in the future, which are social determinants of health. And I just want to take a moment to explain that in lay people's terms, which is the idea that the health of somebody is much more than what their genes are and what their profile is. It's a function of many different things. If you don't have adequate housing to live in, the stress of that and the exposure is going to impact your health. If you don't have quality nutrition from your food source, that's going to impact your health. If you're exposed to environmental and chemical pollutants early and frequently in your life, that's going to have an impact. If you have stress, particularly that can come from economics or the lack thereof, that is a factor of your health. And looking holistically about this, we realized, and what you said, Dean Williams, is that the COVID pandemic has laid bare the inequities of health. It has not been an equal disease amongst it. As you know, the Black and brown communities in the United States have been far more impacted as a percentage than others. And there are reasons for it, because there is built-in systematic and systemic inequalities in these social determinants of health. And so I think again, I agree with you that people are talking about it. It's a new phrase for the general community. It's starting to percolate. I think the more awareness, the better. But I also try to always focus what people can do today. And I want to give a message to the Shaklee family members are out there, is that we often talk about health and income, right? Because we provide income, even small amounts of income to people, and then a community to support and encourage. And the income and the supporting community are really helpful factors, right? In addition to the education to get the chemicals out of your home to the extent that you can and help people. So do you not agree that those things are important from the health at the end of the day to get equality?
Absolutely, they're important. I think one has to appreciate that when we talk about a social safety net, we are talking about the income of the family, but we're also talking about the environment around this family. And is it an environment where crime, where policing is invested in safety, public safety, as well as the environmental responsibilities that they have, that the schools are well funded and well supportive of addressing the needs of their population, that fair employment practices are in place, that there's green space for recreation, and that there are mental health services and supports. All of these are factors that pretty much account for 80% of our health and wellness. And social determinants, when supported and in place, are really the core safety net, the core basis upon which health and wellness across the life course depends. So I'd say that there has to be a commitment to do that, to support healthy environments. There has to be environmental justice to make sure that power plants and other dirty industries are not left to pollute environments where people live, work, learn, and play. We need the integration of the science with the social political will and the leadership to have policy written and put into place to support people. And first and foremost, I think all of us have a role in this by participating in our community, by appreciating and understanding where there are social injustices happening, to not be bystanders. I think one of the amazing things this summer is observing just how diverse the communities of peaceful protesters have been. They represent all walks of life. In the George Floyd demonstrations were happening all across the globe, because there's a recognition that social justice impacts all of us. And it's not just a US phenomenon. It was remarkable to see in Germany, in Japan, in South America, people recognizing the importance of social justice as critical as a time as we're in during a pandemic.
Yes. Well, I'm going to ask you maybe one last question, which is a different tact. So you're Dean Williams, you're thinking about impacting the population health of 7.4 billion people around the world. You're addressing issues of social determinants of health and equality across race and gender and ethnicity and everything. How do you decide what to do in the morning? I mean, that's like overwhelming. When you wake up in the morning, what do you do and how do you figure out how you're going to spend your day?
That's a great question. I think, Roger, to be honest, I wake up every day as a dean of a school that gave me purpose. I started at the Harvard Chan School of Public Health in 1986 as a student. And I found public health because I really wanted to marry my passion for biology with my drive for having impact on the humanitarian side in a global way. And so I wake up every morning asking, how can I enable, how can I support the wonderful people, the students who come to the school, who run towards, not away from challenges. I'm inspired by that. And I wake up wanting to enable them. And I do that directly and indirectly by enabling our faculty members, by enabling our staff, and members of our practice community to get these young folks to be out on the front lines to solve problems. I've been inspired by so many who are related to our school that I feel it's a moral imperative for me to work every day to enable people to solve problems that address humanity's biggest challenges. And, you open this question by asking, what is it like to be the dean of a Harvard School of Public Health during a time of pandemic? I couldn't think of a better place to be because I'm at the nexus of where innovation and practice and passion exists. And the people in this space with me have the skill and the desire to make a difference. And if I can continue to enable them to do that, it's a good day, even during a time of pandemic.
Well, let me just end by saying, never has there been a time, at least in the last 100 years, where the output and work of the Harvard Chan School of Public Health is more needed. And in my opinion, never has there been a leader of that school who is more fit and prepared and the right person at the right time for this moment than you. So on behalf of our 2 million members of our Shaklee family, thank you for advancing the state of public health. In my capacity, because I am involved in the School of Public Health, thank you for being the leader, the right leader at this time. And thank you for sharing your thoughts and ideas. I think it's such a privilege for all of us to have some insight into your mind and what you're thinking of. And it's so rare for everybody to have access to this kind of conversation with a leader of your stature. So we thank you for your time.
Thanks so much, Roger. I appreciate this opportunity to talk about my passion. Thank you.